Hi, good afternoon, Mr. Leon. My name is Yela, and I'm gonna be your nurse practitioner today. I'm gonna do your assessment. So I'm gonna go wash my hands and I'll come back with you.
Okay.
So can you verify for me your name, date of birth, and where you are right now?
Yes, I'm Diana de Leon, January 5th, 1985, and we're in the clinic.
So we will take the patient's vital signs. They're all within normal limits, and we're gonna start by the head. We're gonna check. I'm gonna put my hands on you if that's okay. We're gonna check the skull for any lumps or lesions. Okay. The hair distribution is evenly. We're gonna check the face. The patient's face looks symmetrical. We're gonna check for the temporal artery and the temporal mandibular joint. Can you open and close your mouth for me? Okay. We're gonna check now your ears. Have you had any drainage that you have noticed? Any pain or discomfort? Okay. So we're gonna check. We're gonna pull the pain back, up and back. We're gonna use the otoscope and check. It should be fairly gray. And then we will do it on the other side. We also get the pena up and back, and it should be fairly gray with the otoscope. We will check it. So now that we're finished with that, we're gonna do the hearing, and that's hearing number 8. So we will ask the patient, can you hear that? Can you hear that? And we will do it bilaterally. And then we're gonna do the Weber test. We will grab the tuning fork and put it in the patient's head. Can you hear that? The patient should be able to hear it bilaterally. Okay. So once that's done, we will check for the rhino test. The rhino test, we will also use the tuning fork and put it on the mysoid process, and then we will ask the patient to let us know once she will stop hearing the vibration. Once the vibration stops, we'll put it on the front, and then we will do the same thing on the other side. We will get the tuning fork and we'll put it on the mysoid process in the back. Once the patient stops hearing, we'll put it from the front. So we will check for cranial number 2. We will put the patient at 20 feet, and then we will use a Snelling chart and ask the patient to read the smallest print, and the patient should be 20-20. If it's not 20 to 40, that means that the patient will be able to see 40 feet of where a patient sees at 20. So we're gonna now do the confrontation. So we will ask the patient to cover one eye, and we will cover the same eye, and we will ask the patient to let us know how many fingers she sees.
2, 3,
Okay, and then the other side, we will do the same thing.
2,
Okay, now we're gonna check the sclera. The sclera is bilaterally wide. There, I don't see any drainage or any discolorations. The shapes, they look normal and symmetrical. We're gonna use the pen light. We're gonna check for perla. Okay, can you look at me? So the pupils are equal, round, and reacting to light. So we're gonna check for cranials number 3, 4, and 6. We're gonna ask the patient to follow our pen. And we're gonna check for accommodation. Okay, so we would darken the room using the ophthalmoscope, and we should be able to see the orange glow in pupils and the red reflex from the retina. So we will check if each eye, okay, and they're both. So now we're gonna ask the patient to tilt her head back, and we will check the nostrils. The septum is intact and is mid-lighted. To check for cranial number 1, we will offer the patient to smell coffee or any particular smell, so the patient should be able to identify what we're giving her to smell. So, and then we will go down to the lips. So the lips, they look pink and moist, they're not cracked. We will ask the patient to open up her mouth. And can you open up your mouth, please? Open up your mouth. So say ah. Here we're checking also cranial number 9 and 10. The uvula, it's midnight. The soft and hard palate, they're pink and moist. All the gums and teeth and tonsils, they're intact. So right now we're gonna check the neck. So can you flex your neck back for me? We're gonna check for the trachea that is midline. and we're gonna check for the cricoid, and then we're gonna check for the tree. I mean the thyroid. Can you swallow for me? There's no lumps. So, oh, we need to check for the nodules. So here's a auricular, some mandibular, some mental, and some clavicle. You shouldn't be able to palpate the nose. So we're gonna do now, we're gonna ask the patient to turn to the patient doesn't seem in any distress. She doesn't seem like any sign that she's cyanotic or she's using any accessory muscles. So we're gonna do the check for fremitus. We're gonna ask the patient to turn to the side and we're gonna start. Okay, can you say 99 for me?
99, 99, 99.
Okay, so since we're here in the bottom already, we're gonna check for expansion. We're gonna ask the patient to take a deep breath. And it's evenly. Okay. So now we're gonna percuss the lungs. And when we stop, when we're percussing the lungs, when we stop here in residence, we're gonna ask the patient to take a deep breath, and we're gonna check for the diaphragmatic expansion. We're gonna ask the patient once she takes a deep breath and we don't hear resonance anymore, that should be between 3 to 5 millimeters, okay? Sorry, for the diaphragmatic excursion is 3 to 5 centimeters. Okay, so since we're here, we're gonna auscultate the patient's lung. So we're gonna ask the patient to take a deep breath for us. And since we're here in the back, we could check for the patient's kidney. We're gonna ask her if she has any pain. Do you have any pain?
No.
Okay. So we're gonna ask the patient to turn back around and check the patient's breast. We would check check it in a normal regular setting, but since we're here, we're gonna ask the patient if she has any mass lumps that she has felt recently, or that she has any discharges that she has noticed coming out. Is everything okay? Okay. So we're gonna do now, we're gonna check for the carotid artery. There's no fluids that you can see. No. There's no pulsations that I'm able to see. Okay, so we're gonna auscultate for fluids with the bell, the stethoscope. Okay. Okay. Now we're gonna palpate the apex of the heart, which should be here in the fifth intercostal space. And then we're gonna auscultate the patient's aortic, pulmonic, earth, cricus, and mitral, and we will ask the patient to turn to the left hand side so we can auscultate the apex of the heart, which should be here. Okay, so now we're gonna go down the abdomen. We start by inspecting the abdomen. The shape, it looks symmetrical. I don't see any lumps or distension at this time. So, or pulsations. Do you have any discomfort? Okay. So we're gonna auscultate. We're gonna check for vowel sounds. And we're gonna start from the right lower quadrant forward. And since we're here, we're gonna check for the aortic, renal, and the arteries. With the belt, I don't hear any fluids, so we're gonna keep them going down. We're gonna percuss now the liver, which we should feel it on the costal margin. And the spleen also. We're gonna percuss the spleen, but we shouldn't be able to percuss this. We shouldn't feel anything while we're percussing the spleen. Okay. So now we're gonna start by, we're gonna do the Rosen sign. We're gonna ask the patient to, once we take off the hand, if she has any pain, if she has pain, it could be appendicitis, and she should be feeling the pain on the right part, on the right side quadrant. So we're gonna also check if we're gonna see if the bladder is distended. the bladder doesn't seem distended, you should feel it if it distended. We shouldn't be able to feel it distended. Okay. So now the patient, if you're looking at the patient, she doesn't seem that she has any deformities, edemas, or enlargements over her extremities or upper. We're gonna do the Phantom test. Now we're gonna ask the patient to bend her wrist for 30 to 60 seconds. If she has any pain, it could be that she has carpal tunnel syndrome. We're gonna ask the patient for do range of motion. Since you already have your wrist like that, extension and flexions of the wrist. Do you have any pain? Okay. We're gonna ask the patient to do abduction and abduction with her hands each side, and then outside, and then can you stretch your arms up and then put it in your back, which each side as further down as you can. Okay, so since we're here, we're gonna do prayer number 11. Can you push your arms up? Okay, and we're gonna tell the patient to. Okay, we did the right. We're gonna do the nurse test. So for the nurse test, we're gonna ask the patient. We're gonna put the hand on the scapula, and we're gonna ask the patient with a thumb down to see if she has any pain. Okay. And we're gonna do a bilateral. We're gonna put that hand on the scapula and the thumb like this. Does she has any pain? No. Okay. So we go on now. We're gonna inspect the spine for any kyphosis, scoliosis, or lordosis. So we will ask the patient to stand up, bend forward, and while we're doing this, we could also palpate the spine. Okay, that's it. And then I'm gonna ask the patient to put her hands on her hips, bend it forward and backward as far as you can. Okay. And we're gonna now assess, and side to side, please, as far as you can. Okay, do you have any pain at this point?
No.
We're gonna now assess your knees, if you can sit down for me. We're gonna, for any fluids, we will do the balancing test. For the patient doesn't see that she has any fluids on her knees, so we're gonna do now the term is meniscus. So we will ask the patient to bend her knee and internally and externally rotate, and we shouldn't hear any clicking sound. Okay. So now we're gonna ask the patient, let's go check the gait of the patient. We'll ask the patient to stand up, walk forward and backward. And we're gonna ask the patient to stand up with the hands to the side for the lumbar test, and there should be no swing. Okay, so now we're gonna check the tender reflex for the patient. If you please could sit down for me. So we're gonna do a bicep. And a tricep. Okay. So now we're gonna do the serosognosis for the patient. Can you close down your eyes for me? You should be able to identify what I'm giving you in your hand. Give me 1 second. There we go.
Coin.
Yeah.
A pen.
Okay. And then we're gonna do the graphesthesia. So I'm gonna write something in your hand and you should be able to identify it.
3.
Okay.
Can you do it again? 4.
So now we're gonna check the peripheral system for the patient. The patient doesn't see that she has any eczema. Her skin color is normal. And we want to check the dorsal pedis and the tibia. So we'll check the tibia and the dorsal pedis, and that should conclude our assessment.